Hey there, it's Brad. As someone who's passionate about podcasting, I've always thought there should be more support for physicians who want to share their stories and expertise. That's why we're launching Doctor Podcast Network.
We're bringing together a community of physician podcasters with one goal in mind: to provide the tools, connections, and resources you need to grow your show. So whether you've been podcasting for a while or maybe you're just starting, we've designed this network to support you every step of the way, and we're going to help each other rise, not compete.
If this sounds like something you'd benefit from, we'd love for you to join us as we get closer to launch. So you can sign up at drpodcastnetwork.co for early access. Stay tuned for more details in the coming weeks. Really looking forward to what we can create together. Doctor Podcast Network, where doctors podcast.
Doctor Podcast Network, where doctors podcast.
Doctor Podcast Network, where doctors podcast.
Hey, this is Brad Block, host of The Physician's Guide to Doctoring. This is a personal and professional development podcast for physicians where we have experts on the show that try to teach us everything we should have been learning while we were memorizing Krebs cycle. Welcome back to the podcast. On today, we have an amazing guest, a recurring guest, and we're going to talk about, unfortunately, what it's like to get sued. So we have Dr. Gita Pensa. She's an adjunct professor, associate professor in the Department of Emergency Medicine at Brown University, and is widely recognized as one of the nation's leading experts on malpractice litigation, stress, and physician litigation support. Her open access podcast curriculum, Doctors in Litigation, the L Word, is an introduction to the practical and psychological preparation necessary for malpractice litigation defendants, and I think should be mandatory listening for anyone in medicine. And it's actually now used as a teaching tool in medicine law and the malpractice insurance industry. So she's currently working as a consultant to medical malpractice insurance companies, hospital systems, defense attorneys, and is also a well-being and performance coach for defendants in litigation. So if you yourself are getting sued and you are struggling, definitely reach out to her. She's an amazing resource. She's been featured in forums such as Time Magazine, South by Southwest, NPR, and a new PBS documentary, A World of Hurt, How Medical Malpractice Fails Everyone, which was actually created by a medical student, unbelievably. You can find more about her at doctorsinlitigation.com. Dr. Pensa, thanks so much for coming back on the show.
I'm really happy to be back here again. Thanks for asking me.
So the first season of your show, it was like a complete book, right? Like beginning, middle, and end. But this next season, you're writing book number 2. So what do you think still needs to be explored?
Oh my goodness. So much. I think I would say for people who went into the process knowing nothing and then listened to season 1 and realized, oh my goodness, there is so much I didn't know. I think you're doing yourselves a disservice by thinking like, okay, and that's it, because there's probably just as much that you could learn beyond that. And I really think I come at this from this feeling that I feel like every physician should be a good defendant. Everybody should know how to be a good defendant. With season 1, you learned about the landscape and the problem of litigation stress and why people feel litigation stress and some basic skills around deposition and trial. And there's still a lot to know. The other thing that I didn't really approach in season 1 was anything about what I do in terms of mindset work with the people that I coach. I do a lot of work around their thoughts and their mindset and how to show up the way you want. Season 1 might be telling you how it is that you might think about showing up, which could be different than what you had in mind before. And now we're going to explore all sorts of litigation adjacent topics that we didn't hit in season 1, plus a little side of coaching.
Okay. So that begs the question, like, why is someone like you even necessary, right? Doctors that are part of a large healthcare system. Why isn't the healthcare system serving that role? Or your malpractice attorney. Why isn't the attorney that's representing you preparing you in such a way? Like, why is there this vacuum that needs to be filled? Why aren't these other parties doing what you're doing?
So let me address those two things separately. In terms of why the defense attorneys aren't doing it, they're not doing it because historically they haven't really needed to do it. In other words, physicians are pretty smart people. They give them a set of instructions. The doctor has been sort of white knuckling their way through all of these months leading up to the deposition, really suppressing all of their fears about it and living in shame and stewing in all these really complex emotions with really no help or outside, but they don't complain. So everybody seems okay with it except for the poor doctor who's isolated and really suffering. And then when it's deposition time, I mean, who knows how to show up in crunch time better than a doctor, right? So the doctor will take whatever instruction the attorney gives them and then usually put on a decent performance by the time time deposition comes around. Is it optimal in a lot of cases? No. But do they sort of just stumble their way through it? Oftentimes, yeah. They just have not had the understanding that the way they've done it is the way they've always done it.
Yeah.
And the way they've always done it is just to give the doc a session or two right before the deposition. And I don't know that they know the degree to which that's a disservice for doctors who really alleviate anxiety by learning. If you knew what to do, then you would be a lot less nervous about doing the thing. But we don't know how to teach ourselves the thing, and there aren't any resources. Now, for the hospitals, essentially other doctors set the standard for what we're being taught, right, in residency programs and what we're learning about CME-wise. That's all driven by doctors. And for doctors, they do what they've always done too. In other words, not talk about litigation, just talking about risk management, how to avoid it. The trouble with talking about litigation after the fact is that it's completely just infused with shame. People don't want to talk about their own personal experiences in it. It's like we're just swimming in water of shame around this topic.
Yeah.
And we don't even know that's what we're doing. We've just neglected it for so long that no one's given thought to it to think like, gosh, I wonder if we taught more about this, if doctors would have less shame around it, if they might be able to show up better and prepare better.
So ultimately what you're saying is we're doing it because of the reason we do a lot of things, because this is the way it's always been done. And because nobody's said, hey, there's a better way until you really.
I would say until Sarah Charles. There's a psychiatrist who started this work, who started writing about it in the 80s, I think. And that's whose work informed. So that was the first stuff I got to read ever about anyone having written about the physician perspective in litigation. And there have been some voices here and there. Louise Andrew has been on my show before. She's part of the podcast people I interviewed. But no, I think perhaps this is the first time that someone has made like a really concerted effort to change our society around this.
Which I think ultimately might make a difference, right? Because there is a calculus that these plaintiffs' attorneys make about what they can get away with, what they can say. And so if we're better equipped to push back and they're less successful in their pursuits, that leads to less litigation because it's expensive for them, and losing, they're going to be less incentivized to go after those types of cases. So I think this might be the first of many dominoes that fall that really start pushing things in our favor. It's a very optimistic view, and I tend not to be that way, but it really gives me a lot of hope for the future of something that we've really been outgunned at. And part of the reason we're outgunned is because of lobbyists, right? There's a really strong trial attorney lobby. And so they say they do this all in the name of patient safety, because I feel like you can get away with anything if you say it's for patient safety, right? And they say it's for patient safety, and really it's their financial.
It's in the name of the people that they serve.
This is how they make money. So we've been outgunned because our lobby presence is minimal. And so this is something that would then push back against that.
I think that everybody has to understand the things that they can control in this system. And I'm not saying that we should be educated and prepared for the system as it is without making really sincere efforts at whatever turns we can make to change our reality.
Yeah.
So yes, I am for any sort of measures can create conditions that are friendly to tort reform. I think it would be smart for people who know their state legislators to push for things that might make more sense in their states, right? We're seeing these nuclear verdicts, and we can talk about that sort of thing later, but there has to be some pushback against some of this crazy social inflation that has been happening with these verdicts if people want to have doctors and they want them to be insured. And so working at things from the legislative level is completely and 100% necessary. However, in the near term, when that's the system we have to deal with, it makes sense to know how to operate within that system as strategically as possible to really help your defense. I think that that's something that we should all know how to do. Know the things that you can influence, the things you can't, and know how to show up just, in those areas where you can, put your best foot forward. It can only help.
Yes. So we can and should do both at the same time. Absolutely. Hearing you describe in the last season, like the arc of your own story and then seeing your professional journey has really been an amazing thing. And I think to hear about it, especially for someone who's going through a pretty dark time, whether it's litigation or something else going on in their life, because you've managed to reinvent yourself. And now this really dark time in your life has become an integral part of your identity. So can you tell us how you managed to do that?
It was over. I can't say that it was one decision. I can say that, perhaps it started in 2015 when my verdict was overturned. Since then, I really just made this commitment to looking for the next best step. Just what's the next, I wasn't thinking really far in advance back then. It was literally like, how do I get through tomorrow? How do I get through next week? How do I make the next few months bearable? How do I make my life better in the time that I'm just waiting in uncertainty for this thing to happen? And when I finally opened myself up to outside influence, that is something that I had been just willfully opposed to the whole time since my case started in 2006. Just had my head in the sand and was just completely emotionally reactive. And yes, I was a very, very different person. And really, it was just in the pursuit of a better life. I just wanted to feel better. I wanted to be happier with what I did at work. I wanted to be more present for my family. I wanted to know how to make choices that would really just help propel me in a direction that was clearly the direction I'd been going in. There was really not much but pain there for me, is what I realized. And it was just this gradual thing where bit by bit, I just sort of acquired these skills nearly accidentally just because I changed my career in that pursuit of changing things up for me in a way that I like better. I learned to podcast, all this stuff. And it really just one day, this thing hit me about like, hey, because I'd been noodling over how do I teach this to like a larger audience. And then the podcast came to me. And then I was just focused on making the podcast and getting through the trial and doing all that. And then when I won at trial and then the podcast came out and then people started contacting me after having listened to episodes, they would reach out, they would just find me at Brown and say, can I talk to you? And that was what made me first really start thinking about, well, I don't know what kind of skills I have to really guide these people. Like maybe I should learn more about that. And it really has just been like, what's the next best step? With this feeling, though, all along that I can make progress, that I can move forward, that I can continue to influence things. And then the more opportunities came along, I just took them. I was like, I don't know, I've never done a keynote speech before, but sure, I'll try that. I was scared. I was really scared. But I had learned to coach myself through difficult things. I think the coaching skills were really integral to not only helping the people that I'm working with, but it really helped me. So not only do I believe in the capacity for post-traumatic growth, and I do offer myself as a role model for it when we're talking about litigation specifically, but I also know that sometimes pushing back against cultural limiting beliefs about what's possible for us as doctors, about what we should and should not be doing that hold us back, I no longer believe in.
It's interesting that you put it that way because I've had a lot of coaches on the show, and that seems to be the common theme because often they become coaches because they've been coached themselves and had such a positive experience. They want to spread the gospel.
Yeah.
And so the limiting beliefs, pushing back, and a mindset of service, which seems to be there. You're like, I've got these people calling me and I think I can help them, but maybe I should learn to find out how to do that better. And so you're like, you're putting one foot in front of the other. You're consuming material that's going to help you, that's going to then help other people. And there seems to be, obviously in retrospect, kind of it all falls together and makes sense. But I guess at the time, it was just putting one foot in front of the other. It was healing from your own wounds and then being able to pass that information on to other people. It's almost like man's search for meaning.
Yeah, very much so. And I would say that at some point you're so focused on your own feet and putting them one in front of the other. And then you get to a place where you feel pretty good and you put your head up and you're like, where am I? Like, look at all the stuff I did and where I am. Like now I feel like I might be in a position, like I've got a story to tell. I've got skills to share. I do think about this differently. I have a message, and even that message and that approach continues to evolve. And that's one of the really fun things about feeling like you're breaking ground. Something is that you don't know what direction to choose. You try, you experiment, you're really in uncharted territory is what it feels like sometimes. And it's exhilarating.
So what you alluded to earlier is that you help people with mindset during their litigation experience. And so what are some of those limiting beliefs, as you said earlier, or just some of those thought processes that you help your clients with?
One, there are a lot of different things that limit physicians when they come into it. So one of the things is sort of figuring out what is your perspective coming into it? What are the things that you believe about it? Oftentimes, I will work with a doctor who did everything right in a case and yet has so much, I'll use the word guilt, because they feel like they somehow could have done better, somehow should have seen this coming, some way could have intercepted on the behalf of their patient for whom they believe themselves to be the steward. And so these feelings are very real. They feel highly responsible, even though their medicine was good. They doubt their own abilities now because this thing happened and they feel like it ought not to have happened. And because of this, it's very difficult for them to show up and defend themselves. They don't really feel like defending themselves, even though their care was excellent. By
They
any
almost
objective
want to fall on their sword, right? They feel like there's this need to be cleansed of their sins.
Yes.
And
they feel like they don't, for whatever reason, there is a feeling of, I call it deservingness, but when something terrible happens, it's much worse when they feel like they were responsible. And many times I hear this story and I'm like, you didn't do anything wrong. Like you did everything right. Why are you feeling like this? But they feel so much really intense responsibility and ownership, and they just feel like they can't defend themselves. They actually don't want to, and they don't feel like they to want to. And so working around that, I offer people constructs to understand what it is that they're feeling. I don't love the term second victim, but I'm happy that we have a term, right? For a long time, we didn't even have anything in the vernacular to explain the fact that people who take care of other people hurt when something goes wrong with that patient. When that patient hurts, you also hurt. And there was no good word. No one even knew that it was happening.
And if anyone wants to take a deeper dive into that, we've got episodes from a few years ago with Dr. Stacia Dearman, where we talk about what the second victim is.
And so I use grief as a construct for them. So this is grief, like what you're feeling. It's an acute loss, a sense of regret, just a keen suffering around some acute change, right? And when you are the steward for that person, you feel like you're responsible for them. Like grief to me is the best framework to use, where in society, you know that grief is coming for you at some point in any loving relationship that you have. And you enter into it willingly, even knowing that grief is probably lurking there somewhere. I tell a story about, like, I had a dog. When that dog died, I never thought I would get off the floor. I was completely surprised by how much grief I felt for a really long time. And I swore I'd never get a dog. Now I have a puppy. You can probably hear her at some point. But you enter into that relationship knowing, like, okay, there's going to be a price to pay for this at some point. You understand that about your relationship. People do not come into medicine understanding that relationship, because at some point, that grief is coming for you. It will be with an error that you make yourself, and then the grief is around like you really letting yourself down and hurting someone, or it's about a tragic mishap where something terrible happens to a patient that you feel responsible for. But that feeling for the tenderhearted among us that really, really care about the people that we take care of and for whom this work has great meaning, that is grief. And you're going to have to work through it. But it doesn't mean that it has to last forever. Yes, there is a period of suffering that goes along with that, but you are allowed to have an end date to it. And we don't understand that. We don't have any role models of it. For grief of relationships, you see people in the community, you read books, you understand all of that. You've never gotten to see anybody really like grieve and then move forward in a positive way after an event like this in medicine. But I believe that not only do we deserve to defend our care when everything is right, we also do need to somehow defend the practice of medicine in general. Like when your choices were reasonable and you did the things that you were called on to do in a given situation, I do believe that we also have a responsibility to defend how medicine is practiced, because people have a very inflated idea of what medicine ought to be able to deliver, which is essentially perfection. And that's not a fair ask.
Perfection and immortality.
Yeah. Both. And so getting people to work through those emotions while understanding that they do deserve to be able to process this and move forward and defend themselves. They do deserve that.
And something that I remember us talking about last time was that the plaintiff's attorney will leverage that against you. They'll see that.
Oh,
and they know
100%.
that. And they twist the knife. The knife you've already put
in yourself.
You put it in yourself, and they are going to twist it to their advantage because they know they can. And that's how the game works. And for them, it's a job and it's business. And for you, it's personal, because grief is personal. Grief is not business.
Grief is personal. Now, one of the things we work on, though, is the ability to not process that grief in your deposition or anywhere in front of that plaintiff's attorney. Like, that's not where you do it. You have a job to do. And so I encourage people to recognize they have two goals and grieve. One of them is and they may not be grieving. They may just be full of rage. They may feel like people come at it with lots of different perspectives. They may be so enraged by the unfairness of this. They may may be consumed with bitterness. They may be so upset at the expert witnesses that they are just eaten alive by this rage. For any of these paths, the first thing that has to happen is acceptance of the current situation, right?
Yeah.
Because we argue against reality. We argue it shouldn't be this way. It shouldn't be this way. It is this way.
Yeah.
And until you can get to the it is this way, then you don't know how to move forward strategically. You can't drop the emotion in order to think in a smart way, right? You can't do that. So that's one goal, is to be able to process those emotions. And that takes time, and to give them a framework to work through it, understand where the litigation stress comes from, understand all that. The other goal is to be a good defendant. And those two things don't overlap, right? To learn to show up as a deponent or as a witness, not as a doc. They're two different things. And learning the skills and what's expected of someone and what a good deposition is, and that you are in fact allowed, quote unquote. People feel weird about preparing for deposition. They feel weird about, they say like, I don't really want to be careful with my words. And I'm like, well, you can be thoughtful with your words. How about that? You don't want to use the word careful. How about
difference.
thoughtful?
Yeah.
It is, but somehow it makes them feel different.
Yeah.
So I'd like you to be thoughtful about the way you express these things.
Because the plaintiff is going to be weaponizing their own words against you. Why would you not want to be as prepared as possible to defend against that? They are literally attacking you.
Well, I think people they do want to be prepared, but they have incorrect ideas about what prepared means or what the deposition is for. They either want to go in and make that plaintiff's attorney feel dumb for ever bringing this case against them, to show them that I don't belong here and I'm a lot smarter than you and this whole system is stupid. They come
in with that attitude, if I
did.
recall,
I
the first time around.
I certainly did. I know that attitude very, very well, right? Or they might come in with, this is my chance to express, and no, I don't want to say this too black and white. Like, yeah, you can express compassion in deposition.
Like, attrition for what happened to the patient.
Exactly. You don't want to fall on your sword in the deposition. Now, in cases when there are clear error and you have to go through a deposition, like, yeah, you're going to answer the questions. You're under oath. You're going to have to do that. But it's interesting. Like, once you start to show people examples of how this could go, then the light bulb starts to go on. When you start to show them, like, this is how the plaintiff's attorney lays a trap for you. Yeah. Right? They start by asking this kind of broad, it's like a funnel, right? They start by asking these questions, are narrower and narrower, and now you're stuck. So knowing how to recognize these things ahead of time, that's a wise thing for you to do. Like, you should feel like you can prepare yourself, and you can. Even when you feel like you did something wrong, you probably didn't do as much wrong as they are saying you did wrong.
Oh yeah, definitely. Because they name every possible thing. You even billed wrong for the visit, like everything that they can.
They love
the
talking about standard of care on charting. People, there's no standard of care around charting. Can we just get that straight?
If you can bill for it. When you're in deposition, you want to be the doctor that the plaintiff doesn't want to put on the witness stand. So someone who's unflappable, that knows the material, and they're not going to be able to rile them up or set any traps for them. But then on the witness stand, you want to be the doctor that the jury would love to have as their doctor. So exactly. I love those two different frameworks, and they make so much sense.
Exactly. But it's a long way before you get to trial. And a lot of times I'm dealing with people who cannot even wrap their minds around that first step.
And mostly it doesn't go to trial. Most of these cases do not go to trial. They often settle. Yeah.
Correct. Most of them will go to deposition, though. Like, really, everybody ought to know what a deposition is and isn't, and how they can put their best foot forward, and know that they deserve to learn about this and show up and do a good job. You do.
So there's one more question that I want to get to, and it's a little in a different direction. And it's because of the current climate and all of the misinformation that's out there about healthcare and medicine and science. One thing that you've become adept at is communicating uncertainty, because you need to be able to communicate, right? In medicine is ripe with uncertainty. That's what we're dealing with. We're constantly grappling with unknowns and making decisions based on a lack of information.
Right.
And so can you give us some tips for communicating uncertainty with patients and with a jury? Because I think that can then translate also to communicating uncertainty with the public, which is something we need to get better.
Yeah. And so, okay, let's talk specifically about a jury. So for the jury, now juries are usually made of reasonable people that don't know much about medicine. They will come in with their own sort of preconceived notions, but they're usually capable of understanding that they are supposed to look at a case as, is it reasonable for the doctor to have made these choices knowing what they did in that moment? And that's what the whole thing is going to be argued over the whole time. That being said, there are going to be all sorts of crystal ball questions. Looking back, don't you wish that you would have done something differently that day? All sorts of questions like that. And if you answer those to the like, yeah, I wish I did something different, then, you're sort of sunk. you have to be the person who is able to bring it back to, I wish I had a crystal ball that day, but I didn't. And I made the best decisions that I could at the time with the information that I had, knowing that we don't have crystal balls.
Yeah.
We don't have them. We wish we did. And so I think that when you're talking to a jury, remember, it's not just your job to communicate that to the jury. It's also your attorney's job. You're going to be working as a team. The attorney is going to remind them over and over again how to think about this, like how to put themselves in the doctor's shoes. Your experts are going to continue to hammer those points. They are going to time and time again try to get everyone to look at this with the retrospectoscope, so to speak. And it's your job to say, I did not have the information at the time. This was a reasonable course of action at the time. And you do have to sort of stick to your guns when they come back at you and say, don't you wish you did something different? You can say, I wish I had a crystal ball. I wish I had been able to look into the future, but I am a human being and I can't do that. I'm limited by being a human doctor and practicing good medicine.
I'm limited by the time-space continuum. I cannot get off my reality.
That might sound a little cheeky if you say it that way. But
this is not a Marvel movie.
But yeah, I mean, the point is you do have to communicate that. And it is a tough job sometimes because they don't know medicine. Filling in those gaps is hard. And so being as plain spoken as possible, to use analogies that they would understand whenever possible, to bring it to some level that they can comprehend. Some cocktail party level of understanding. I was working with an OBGYN and we were talking about one of the questions they were asked in the deposition was, how do you decide when someone's labored long enough? And she was like at a loss. She was like, it's been this many hours and like, these are their risk factors. And I was like, well, you need to find a way to really succinctly explain that to somebody. And it could be something like when the risks of continuing to labor are really more significant than the desire of the patient or whoever to continue with the vaginal delivery. Like you have to have a sentence that explains
So if
that.
I can assume, maybe I'm incorrect, but it sounds like that doctor has so much experience that like all of the risk factors, the risks and benefits are being calculated simultaneously.
Yes.
All the information is being consumed and weighed and has been so for many hours. And
That's
so
right.
that decision has evolved over a long period of time based on a ton of factors that the doctor isn't actively thinking about anymore because of just the way the brain works in heuristics.
Correct.
And so
But you do have to find a way, a simple
but you
way
still
to
have to
express that to the
articulate that.
patient.
Yes,
You have to articulate that
and you
in
can
a
do that,
compassionate
right?
way.
You can do that. You can like, tell me, what are the things that you think about, that you see in the room? Where are your eyes going? What are you looking at? And we do it so many times that we stop maybe actively thinking about it. We're still processing it. So it sounds like
it's amazing like how often that comes to be so important. And the more detail you can put into what you were doing at the time, let's say you're giving trial testimony, right? At deposition, you're going to kind of limit your stuff. But let's say at trial, you're talking about it. You want to show the jury just how thoughtful you are.
Yeah.
How many things you think about, how many things you ask about. And they're going to be like, oh my gosh, that's like, nobody does that in a visit, but you're doing it in your head because you know how to filter, you know
The
how to do
sweat
that.
on her
type
brow,
one,
the
type two thinking.
discomfort on her face, like the clenching of her fists, the heart rate, the blood pressure of the baby, the heart rate of but you know what I mean? Yeah, like all those things
lot of
are
factors
in
together.
fact. So you have to put into words all the things. Yeah.
You put that in together. I mean, another, I'm working with somebody now who it's a lung cancer case. And it was all about like, how long do you let a cough go before you order a CAT scan? Like, how do you think about it when they come in? And she was, I do a review of systems all the time. I ask about this because it could mean this. I ask about this because like you got a long list by the time you're at the end of it, but you have to explain that thinking. And then people really start to get an idea of how thoughtful you are. The worst thing that you can be to a jury is thoughtless.
Yeah.
And somebody who doesn't listen or think or use their senses. And you want that jury immersed, like absolutely immersed in your decision making. And for us, that means we got to slow things down. Like we do have all of these instinctual things that we do. We have to take it down to like med student level.
Yeah.
If you had to explain to the med student, the second year med student, what you're doing, why you're doing, how you're thinking, not even resident level, like med student. That's kind of where you want to land, that degree of explanation without the doctor words.
Awesome. I am so glad that you are putting out season 2 because I love hearing everything that you have to say and teach. And actually, when season 1 was coming out, I was in the midst of litigation myself. So it was totally coming out at a time. And that's why I had you on the show, because often what's going on my show is a reflection of what's going on in my life. So thank you for what you put out there. And for all the listeners, if you've been served, your institution and your lawyers, they have your back, but might not be in the way that you really need them to. And so I would strongly encourage you to reach out to Dr. Pensa. You can find her at doctorsandlitigation.com and definitely listen to her show, Doctors in Litigation, the L Word. And the movie that she's been featured in, A World of Hurt, How Medical Malpractice Fails Everyone. Dr. Pensa, thank you so much for your time and expertise and what you do for our colleagues.
Oh, it's such a pleasure. Thank you for having me.
Thanks for listening. I have a favor to ask. You listened to the episode until the end, which means you either fell asleep or you really liked the episode. So please share it or like it or comment on a social media post or write us a 5-star review. Something. It would really help me out. And maybe what you learned from this episode can help someone else too. The views expressed in this episode are those of the interviewer and interviewee and don't represent the views of their employer or even their significant other. Even though the magic of podcasting make it sound like I'm talking directly to you. This is not a doctor-patient relationship, and this is not medical advice, or financial advice, or really any advice. Thank us again for listening to The Physician's Guide to Doctoring.